Okay, hi, good morning, ma'am. My name is Nell Marlene Hope Legrego, your student nurse for today. May I check for your response? Confirm me that you are the right person. How do you like me to call you?
Jenny?
So, Ma'am Jenny, do you know where are you right now?
Yes.
So, where are you right now?
At the hospital.
Okay, and you know what time is it?
12:02.
So now let's proceed in the inspection of the skin and the nails. So I'm gonna assessing, but before that I'm going to ask you for inquiry history taking. Okay?
Okay.
Is that okay?
Yes.
Okay. First, do you feel any pain or itching?
No.
How about presence and spread of lesions or bruises?
No.
Skin problems? Do you have any historical about that?
No.
How about associated clinical sites?
No. None.
And problems in other family members?
None.
How about related systematic conditions?
No.
Use medications, lotions, or any other home remedies?
No. I don't use any of these.
Excessively dry or moist feel to the skin? Do you experience that before?
No.
How about tendency to bruise easily?
No.
Any association of the problem to the season of the year?
No.
Okay, thank you. That's all for my historical taking.
Okay.
So, ma'am, I'm going to start inspecting your skin and your nails. Is that okay with you, ma'am?
Yes.
Okay, so ipoprovide muna natin yung privacy ng patient. So, I close the window, everything, and then I already perform hand hygiene. So, I'm going to check your skin, ma'am. So, yung color naman ng skin natin, inspecting the skin of our patient, it's not tan, it's normal. It's light brown. Yeah, it's light brown. I think then I don't I can see a mole here, only one mole, and then the moisture, it's moist, parang normal lang siya, hindi siya tama lang yung moisture niya, and then I don't see any scars. I hear. Ma'am, I would like to ask kung saan galing to.
Nasugatan lang po.
Okay, so may scar siya dito. And then, yung temperature naman, ma'am, ganyan mo lang. And checking the temperature. I'm going to check also yung feet niya. Ma'am, same lang siya. Same temperature, so I guess normal temperature lang si ma'am. So, wala akong makita na lesions, any kinds of lesions. By the way, kapag may lesions yung patients natin, we need to use gloves. So, meron tayong gloves dito. So, I'm going to wear these gloves. Okay, so kapag may lesions yung patients natin, we need to use the gloves to prevent the contamination sa bacteria para maiwasan natin na lumala. So kapag may lesions yung patients natin, we need to ask directly to the doctor and note everything that indicates her skin. So, ma'am, are you comfortable?
Yes.
Okay, so comfortable yung teacher. Kapag indications naman namang edema, we need to palpate the skin of our patient. Kapag we press the skin of their patient, then kapag bumalik siya sa dati, then that's normal. No indication of edema. Yung edema kasi, kapag pinipress natin, hindi ngay agad bumabalik, matagal siya. So, yun yung indications. So, palpate the skin and temperature. Already. So, we're going to note the skin trigger by lifting and pinching the skin on an extremity. So, ma'am, I'm going to pinch your skin.
Okay.
Here also. And we noticed that upon pinching the skin of our patient, it turned it back. So it does not mean that the patient is not dehydrated. So I'm going to check also the other one, ma'am. Okay, so there is no indications of abnormalities. So leave the patients in a comfortable positions. And we're going to document findings in the client record. And then draw the indication of skin lesions. If there is any. Pero yung patients natin, there's no indications of lesions in her. So wala po tayong may ililista na nagka-lesions yung patient. So we're going to perform the nails assessment. So first, gusto ko sanang tanungin if you have history of diabetes.
Wala naman.
Okay, so history naman ng peripheral circularity disease?
Wala.
Wala din. Previous injury?
Wala naman.
So severe illness about it?
Wala naman.
Wala. So, our patient. So I'm going to check yung fingers ng patients natin. So it's pinkish, the color, so it's normal. And then if we're going to press her nails, and then magwa-white siya, tapos babalik ulit siya sa dati. So, that's indication na normal pa rin yung patient natin. So, normal na wala siyang any abnormality sa fingernail. So, our patient has a proper oxygenations. Kasi normal lahat yung fingernails in checking her fingernails. So, ma'am, is that okay na magtanong ulit ako sa history, past history nyo, para ma-check ko yung assessment nyo sa head and face?
Okay.
Okay, so ma'am, did you experience any lumps or bumps?
Hindi naman.
How about yung itching sa head?
Wala.
How about scaling or dandruff? Did you experience any of that?
Yeah, meron yung dandruff, pero konti.
Okay, so ma'am, did you experience also yung loss of consciousness?
Hindi naman. Wala.
Yung dizziness nga?
Wala naman.
Seizures?
Wala.
Headache?
Minsan-minsan lang.
Okay, so yung facial pain nyo kapag tumatawa kayo, oyos lang ba?
Yes.
How about, did you experience any injuries?
No. Wala naman.
Thank you, ma'am. So, ma'am, I'm going to inspect your skull. So, first, I'm going to check the size of your skull. So, the size of her skull is round. And the shape, the shape is round. And it's appropriate from her facials and her body, yung size ng head niya. Hindi mas malaki at hindi mas maliit. And then, it's also symmetrical from the other parts. And then, the shape of her skull and the face overall is round. Okay, I'm going to palpate the skull for nodules or masses and depression. So, ma'am, sasabihin niyo kung masakit, okay?
Okay.
Okay, ma'am. So, I'm going to palpate slowly. I'm going to use the rotating motion with the fingertips, meaning at the front, and palpate down the midline, and then palpate side of the head. So, para mas makita natin, mas ma-feel natin yung, makita natin na maayos yung lesions, kapag may lesions yung patients, we could get a boundary. So, here, pa-size natin. So, I notice some marks here from her head of the patient. So, hindi po ito masakit, ma'am?
Hindi.
Okay. So, I'm going to do this again. Wala naman siyang lice. What's the next? Okay, to check any lesions. Wala kang nararamdaman na sakit, ma'am?
Wala naman.
Slowly. Sa likod naman, ma'am. Wala naman scars yung patient na. Okay? And then, I'm going to inspect the facial features. Inspect the eyes for edema and hollowness. Ma'am, taas natin yung mata natin. Okay? Meron siyang redness. And then, hollowness. May eye bag si ma'am. And then, sa taas naman, tingin ka sa baba, ma'am. Okay? Yung redness niya. Sorry, ma'am. So, okay. So, in pressing the face, wala siyang indications of edema. Bumabalik naman sa dati kapag pinipress natin. Okay. So, I'm going to check your facial movements, ma'am. So, ma'am, can you elevate your eyebrows or frown? Parang angry siya, angry. Na eyebrows, pang ganun. Angry, ma'am. Angry, ganun. Yan. So, normal naman siya. And turn it back. Okay. So, lower the eyebrows. Close the eyes tightly. Smile, ma'am. Pop the cheeks. Okay, so how about smile? And show the teeth. Okay, so makita naman natin na normal. Everything has no indications of abnormalities. So I'm going to perform the hand hygiene and document findings in the client record. So ma'am, magtatanong ako about sa past history nyo para ma-check yung neck assessment. Okay, first, do you have any problems with neck lumps?
None? Wala naman?
How about neck pains or stiffness?
Wala naman.
Okay. Do you had experienced any diagnosis of thyroid problems?
Wala.
Any treatment such as surgery or radiation?
Wala naman.
So, ma'am, are you comfortable with that position?
Yes.
Okay. So, ma'am, we're going to perform the neck muscles. I'm going to check through an assessment. So, first, I'm going to inspect your neck muscles or your sternocleidomastoid or your trapezoids for abnormal swelling or masses. Okay, so ma'am, do you feel any pain when I'm palpating your neck?
No?
How about this?
Wala naman.
Ma'am, can you hold head correct? Okay. How about I'm going to ask something for you to do, and then you're going just to comment. Is that okay with you? So, ma'am, are you ready?
Yes.
First, you're going to move your chin to the chest. Okay? Move your head so that the ear is moved toward the shoulder on each side. Pag ganun. Itaas natin yung shoulder and then the other one. Then turn your head to the left and turn your head to the right. And then, I'm going to turn your head against my hand. Repeat with the other side also. Okay? And how about the other? And then next, thank you, ma'am. Shrug your shoulders. Then when I make a pressure, do you feel anything?
No.
Repeat it again also. Do you feel any?
Wala naman.
So sa mga assessment na ginawa ko, do you feel any pain or stiffness?
Wala.
So, as I observe my patient, everything is normal. So, okay. Next. I'm going to palpate the entire or enlarged lymph nodes. Okay. So, ma'am, do you feel any pain?
No?
How about dito?
Wala
Sa
naman.
likod? Okay. So, for your trachea, I just make sure that every lymph nodes has no any lesions or any bukol na makahanapan. At sabi naman ng patient, wala siyang nararamdaman na sakit. So, I think it's normal lahat. Okay, for trachea, ma'am, I'm going to palpate your trachea for lateral deviation. Is that okay with you?
Yes.
So, I'm going to place my thumb here. So, dito, makikita natin kapag men, ang tawag doon is yung Adam's apple ng lalaki. So, ma'am, masakit po ba?
Medyo.
Medyo. Okay, so I'm going to watch how the movements of your Okay, so we notice naman na nakakainom ng tama yung patient. Wala siyang parang abstract or parang process na pumipigil sa kanya ng minom. So, overall, the patient has no indications of abnormality. So, ma'am, are you comfortable with that position?
Yes.
Okay, so I'm going to perform the hand hygiene and document the findings for my client. So, ma'am, sa nose natin, sa nose assessment, so meron na lang akong katanungan for the past history to check your nose history. So, first, meron po ba kayong allergies?
Wala naman.
Breathing through the nose?
Wala.
Wala din. So, sinus infection, kapag meron kang past history about that?
Wala naman.
Nagkaroon ba kayo ng injuries, accidents, ganyan sa face or nose na naapektuhan yung nose natin?
Wala naman.
Nosebleeds. Do you experience sometimes yung nosebleeds?
Yes. Pero hindi naman kadalasan.
Okay. So, meron din bang any medications na prescribe ng doctor sa inyo due to your nose na hindi kayo makahinga, ganyan?
Wala naman.
O any charges and sense kapag nakakaamoy ba kayo ng tama or malakas ba ang pang-amoy niya?
Yes.
Okay. So, ma'am, position yourself. Gawin natin yung assessment. Okay. So, ma'am, i-inspect ulit yung nose nyo. Is that okay?
Yes.
Okay, so, yung nose naman ng patient natin is symmetrical sa kanyang katawan. Hindi siya malaki. Mas malaki sa kanyang katawan. So, symmetrical naman yung nose ng patient natin. Yung size naman is not that little, not that big. And then, for the color, inside of it is may pinkish daw, pinkish. And then, for the flaring, hindi siya malaki yung butas. Mas parang nasa normal lang din niya. And then, I'm going to lightly palpate. Sabihin niyo, ma'am, kung masakit or hindi. And then, we are doing this to make sure na, parang to inform na yung patient kapag gumamit siya ng surgeries or nagkaroon siya ng enhance sa nose niya. So, now I'm going to determine the patencies of the nasal cavity. So, we have the nasal speculum. Example lang to. So, I'm going to get the flashlight. Okay, so, I'm going to light. Dito natin tinitignan kapag may bara yung ilong ng patient natin. Mostly kasi ng bata, yung parang dahil sa speculum natin, napafind out natin kapag merong object, especially sa mga sa mga bata na may hinihigop na mga bagay-bagay na maliliit. And then, sa speculum din natin, makikita natin yung nose ng patient kung may nakabara ba na sipon. It's normal kasi kapag, especially kapag may cough yung patient. And then, okay, so, meron din tayong, we need to, pagkatapos nun, kapag meron tayong na-check na abnormalities, then we need to inform the doctor. And then next, yung gagawin natin is to palpate the lungs of our patient. So, I'm going to palpate it. And then, punta tayo doon sa facial cyanosis ng patient. Meron dito. And then, meron dito. So, we're just going to palpate it. Okay, so, ma'am, do you feel anything?
No, none.
How about this?
None.
Okay. So, ma'am, so I'm going to ask you your past history to check your mouth and oropharynx. Is that okay with you, ma'am?
Yes.
So, ma'am, I would like to ask kung yung routine of dental care, nagpapa-check up po kayo ba ng time to time or a month? May daily ba? May ganun?
Wala.
Kailan naman yung last visit you sa dentist?
Last year, I guess, last year, August.
How about, did you experience any kinds of ulcers and other lesions?
Wala naman.
Yung may pananakit ba ng ngipin nyo? Any discomfort?
Minsan. Minsan.
Meron din bang, sa past history nyo, meron din bang ina-assign yung doctor na gagamutin nyo para, kasi baka may inspection?
Wala naman.
Wala kang disease sa mouth intensa. That's good, ma'am. Okay, so ma'am, i-check natin yung mouth nyo.
Yes.
Okay, so yung color ng lips niya, it's very natural and then hindi siya dry. And then it's symmetrical sa other parts ng body niya. Hindi siya malaki, medyo manipis din yung lips niya. So for the teeth and gums, ma'am, can you show your teeth? Hindi siya okay, so wala naman, nagtutoothbrush naman yung patient natin. Can you open your mouth, ma'am? Okay, so we can see inside. The color inside is the tongue, red, may redness, and then pink. Okay, I cannot see any cavities. Pero meron siyang bawas ng ngipin dun sa pinaka before the posterior. Okay, so wala na yung makita na ako ng iba. Okay, so next naman, punta tayo sa tongue natin to check yung movement. So ma'am, can you move your tongue pag ganun? And then pag ganyan. Then pataas naman ma'am. And then pababa. So we notice na normal naman yung movement ng tongue ng patient natin. So going to salivary gland, can you open your ma'am? So sa side naman ng patient, sa side niya, makita natin na yung color, it's redness. May pinkish din. Wala din ako makita na infection or bleeding inside. And then, for the place and ovula, ma'am, can you lower your tongue? Ibaba mo dito. Ganyan. Sa ovula natin, makikita natin na wala siyang infection. Ma'am. Ayan. Ayan. Tama lang din siyang, wala akong nakikita na infection sa loob. Ma'am, wala kang nararamdaman na sakit?
Ano naman?
Okay, that's good. So, sa oropharynx and tonsils natin, dito naman, sine-check natin dito. Dito yung tonsils niya. Mag-swallow ka nga, ma'am. Okay, so wala naman makikita na abnormalities. So we can also test yung about sa taste niya. We can also put sugar and salt to para i-test yung kung paano yung sense of taste niya. Okay, so yun lang naman. So na abnormalities sa patient natin. Inspect the eyebrows for hair distribution and alignment and for skin quality and movement. We're going to inspect the eyelashes. So, yung eyebrows naman, symmetrical sa face niya. And then, the eyelashes, it's so long naman yung eyelashes niya. So, for the eyelids, we're going to inspect the eyelids for surface and characteristics. Position to the cornea. So, nakaposition naman siya sa socket. Tamang-tama lang. Okay. So, ability to blink and frequency blinking. Nakaka-blink naman yung patient natin. Inspect the lower eyelids where the client's eyes are closed. So, close naman. I-close mo na patient. So, she has a long eyelashes. Okay, so line distributed naman yung eyes niya. And then, inspect the bulbar conjunctiva for color. Can you open your eyes, ma'am? So, yung eyes naman niya, cotton flip applicator natin is 1 cm to kapag sa hospital. Ito yung ginagamit namin to push gently downward while holding the eyelashes. So, hold the margin of the everted lid or eyelashes against the ridge of the upper bony orbit with the applicator stick for your thumb. So, ganun kapag nasa, na natin. Then, inspect and palpate the lacrimal gland. So, we're going to check for the lacrimal gland. So, the lacrimal gland, for the bulbar conjunctiva, we can see na itataas natin yung patient. Ibaba mo mama yung panimo. So, may redness na makikita dito. And then, punta naman tayo sa other one. Same din. So, texture and presence of lesions. So, tama lang yung cornea sa eyes niya. So, inspect the palpebral conjunctiva by everting the lids. Kapag palpebral conjunctiva naman, kailangan nating gumamit ng gloves. For bulbar conjunctiva, i-vert natin yung para i-check kapag merong lesions, infections, or anything na may abnormality sa mata ng patient. So, looking, can you look at the upper, ma'am? So, okay. So, may redness din. And then, pagkatapos nun, invert the upper lids if the problem is suspected. Pero yung patient natin is normal. Ask the client to look down while keeping the eyelids slightly open. Okay? And then, gently grasp up the client's eyelashes with thumb and forefinger. Okay? Ayan. And then, pull lashes gently downwards. Oh. And then, for the cotton applicator, stick about 1 cm above the lid margin and push it gently downward while holding the eyelashes. So, kapag meron tayong so ma'am, we're going to do the assessment of your eyes to test how you have vision.
Okay.
Okay, so let's do first the Sneller's chart. Okay, ma'am? Okay, so ma'am, anong nakikita nyo? Nakikita nyo ba lahat ng letters? Far away from this?
Yung sa taas lang.
Here.
L?
Yeah, it's L. How about this?
R.
No, it's D. So, dito naman sa level na dito. Dito may ma'am.
O.
Okay, dito.
F.
Here.
F. A.
So, parang hindi mo na nakuha to. So, parang hindi ka, you're far-sighted kasi nakita mo, you're nearsighted, I'm sorry, kasi nakikita mo yung big letters. Pero kapag malayo na, so it means na far-sighted ka. You're not far-sighted. So, yan. So, I'm going also to do the, parang, you need to cover your eyes para to check naman kung saan yung mas malakas tumingin at mas mahina. So, ma'am, can you cover your right eye?
Right. I.
So, ma'am, ano nga ito? Anong letter?
L.
Oh,
L.
okay. Here.
F.
Okay. Here.
G.
It's E. Oh, dito naman sa level natin. Dito sa
L.
here.
C.
Here.
A.
Right. You just failed at the last part. The other left eye. Okay, let's test. Okay, so below, what is this letter?
Wait lang, nag-blur ang aking pansin.
I'm sorry.
Okay.
Go. Here.
F. Pas. F.
Here, right?
E.
Oh no, it's Z. So dito.
O. E. O.
So I noticed in this letter chart that you are nearsighted. And then we're going to do the okay. To test naman yung left niya. So I'm going to use my hand. Ma'am, can you cover your right hand? Right left? Right right. I'm sorry. And then I'm going to cover also my right. Okay, so can you see this? What number?
2. 2.
No? 3. Here?
4.
4. Okay, right. Then let's test naman yung right eye. 3? Yeah. I know. It's 2. I'm sorry. 2. It's 3.
3.
4. Yeah. Okay, so we're done with that